Now I'm moving to the next issue in the lung, which we'll get to discuss, and this is what is known as the acute lung injury. Acute lung injury. So for the acute lung injury, we said that it's a clinical syndrome of acute, diffuse, inflammatory lung injuries. So they ultimately lead to what? Pulmonary vascular permeability. There's loss of aerated lung tissues, and there's severe impairment of gas exchange. Alright, so definition: there's acute onset of what? Low oxygen levels in the blood, that's hypoxemia, and there's bilateral pulmonary infiltrates due to left atrial hypertension. So that's the acute lung injury. Then it could also be followed by what? Acute respiratory distress syndrome, which is more of like a more severe form of acute lung injury. So what's the pathophysiology? There's actually damage to what? The alveolar cells. So due to alveolar epithelium and capillary endothelium, that's due to damage to them, things can now leak out. Okay, so there's leakage of protein-rich fluid into the alveoli. Things can leak out, things can leak in. Do you understand? So there's formation of hyaline membranes, loss of surfactant, neutrophils will now be infiltrating, will basically worsen the injury. Okay, so causes: you could have direct injuries like pneumonia, aspiration of gastric contents, inhalational injuries, while you can also have indirect causes from sepsis, from trauma, from pancreatitis, then also due to massive transfusion. Okay, so clinical features: if the onset is acute, you have so much low levels of oxygen in the body. Alright, the bilateral infiltrates when you do chest imaging. Alright, so phases: maybe they have the exudative phase where there's edema, hyaline membranes, neutrophil infiltrate, while the proliferative phase is when there's type 2 pneumocyte hyperplasia. Then we have the fibrotic stage where there's collagen deposition, there's death of tissues, then honeycomb lump. So mainly the issue that such a person is suffering from is difficulties in breathing. So you try to put them on oxygen therapy, you treat any underlying disease, okay, then so on and so forth.